You ever wonder how a small country's healthcare system can have a huge impact like thousands of miles away? Well, we're about to dig into a bunch of stories that do just that. They tell this incredible story of global cooperation, and it starts in some pretty surprising places. This quote right here, it's really the heart of everything we're going to talk about. It sets the stage, right? The idea that for these professionals, healthcare doesn't just stop at their own hospital doors. No, it's this bigger mission, a global one, to find problems and actually do something about them, no matter where in the world they are. So you might be asking, where are all these stories from? Well, they come from a YouTube channel called Israel Healthcare Highlights, and they have a pretty clear mission. The whole idea behind the channel is simple, really. They interview experts and just get their stories out there for everyone to see. So we've picked out 5 really different examples from their work. Each one gives us a unique look into what this global health engagement actually looks like on the ground. Okay, so we're diving into 5 stories from this one playlist. And each one is totally different. They show a different side of this global mission. We're going to see how it all plays out in the real world. Everything from solving a genetic mystery to building a health tech engine and even training doctors face to face. All right, story number 1. This one is basically a medical detective story, and it is fascinating. It links this huge health problem that affects people in Africa and North America to a major breakthrough that happened in a research lab in Israel. It's a real puzzle. So, Professor Carl Skarecki starts with this well-known and honestly tragic fact. People of sub-Saharan African ancestry have a much, much higher rate of kidney failure. But here's where it gets interesting. His students in Israel noticed something odd. This same problem wasn't showing up in Israel's Ethiopian community. That one observation, that wait a minute moment, kicked off a whole wave of research. And what did they find? A specific gene variant. And now that discovery is leading to targeted drugs that are already in clinical trials. We're talking about something that could help millions of people. Okay, so we just saw a super specific genetic discovery. Now let's zoom out and look at the bigger picture, technology. Our second story isn't about just one disease. It's about how you build an entire ecosystem that can crank out solutions for all sorts of health problems. An entrepreneur named Levi Shapiro breaks down what makes Israel such a unique place for launching global health tech. Shapiro lays out 3 key things. First up, data. We're talking 30 years of universal electronic health records. For anyone developing AI, that's like striking gold. Second, startups can test their ideas, run pilot studies, get proof of concept for next to nothing right inside the Israeli health system. And third, access to capital. There are solid government R&D grants that help fund these new, innovative ideas. You put those 3 things together, and you get this powerful engine that's creating tech now being used in places like the US and all over the globe. Story number 3 is intense. This one is about urgent, high-stakes cooperation right in the middle of a conflict zone. Public health expert Professor Nadav Davidovich walks us through how a potential polio outbreak in Gaza was stopped in its tracks. And the speed here was just incredible. So polio gets detected in sewage samples from Gaza, which were partly analyzed in Israeli labs, and immediately the alarm bells go off. The World Health Organization and Israeli public health pros pushed for a local ceasefire, and they got one. This opened up a window for UN and WHO teams to get in there and vaccinate hundreds of thousands of kids, preventing what could have been a total disaster. It's just a stunning example of public health rising above politics. All right, for our 4th story, we're heading to Ethiopia to look at a challenge you might not expect. What do you do about elder care in countries where most of the population is super young? It's a real puzzle. Geriatrician Professor Mark Clarefield is going to share his experience with this. So even though Africa's population is young overall, the number of elderly folks is growing really fast. To tackle this, a group that included Israeli, Canadian, and Ethiopian universities got together. They provided training and, just as importantly, practical, low-cost tools, like portable ultrasound machines, to doctors on the ground in Ethiopia. But Professor Clarefield points out something really interesting. His colleagues in Ethiopia mentioned the modest demeanor of the Israeli teams. They felt it came from a place of real understanding, a sense of we get it, because their own country wasn't a developed nation all that long ago. And for our 5th and final story, we're shifting gears. We've talked about tech and crises, but now we're talking about maybe the most powerful investment you can make, and investment in people. We're going to look at an international master's program that has been quietly shaping global public health for more than 50 years. I mean, the impact of this program is just huge. Think about this. Since 1970, it's trained over 1,100 professionals from 100 different countries. Professor Orapal Teal explains how it works. These professionals come to Israel on full scholarships for a really intensive year. But the key is what happens next. They go back home and become the actual leaders shaping their country's health systems. We're talking ministers of health, heads of major NGOs. This isn't just a one-time thing. It's about building a global, lifelong network of health leaders. Okay, so we've just walked through 5 very different stories. So what's the big takeaway? What are the common threads that tie all of these together? When you step back and look at all 5, a few key themes just jump out at you. There's this deep global collaboration, right? Like with the WHO on the polio campaign. There's a huge focus on training the next generation, empowering local professionals, whether it's the doctors in Ethiopia or the graduates of that master's program. We also see the smart use of technology, from really advanced data analysis to simple, low-cost tools that make a real difference. And underneath it all, you see this proactive, let's solve this attitude, and a genuine commitment to connecting with people, person to person. Those are the threads that really weave all these powerful stories together. And all of that really brings us to one final big question. When you put all these stories together, they're not just individual anecdotes. They point to a whole model, a way of doing things where expertise, tech, and just a basic sense of shared responsibility don't stop at borders. They flow where they're needed to tackle some of the biggest health challenges we face. And that's a model that's really worth thinking about,